Hi, my name is Dr. Christian Nelson. I own Advocate Wellness right outside of Fort Worth, Texas. Our purpose is to connect people with the most effective, fastest health solutions. You're watching my mini course on neuropathy. Welcome back to my series on neuropathy. Today we're talking about what is treatment like for neuropathy at Advocate Wellness. It's an amazing question. We've been getting this question from a lot of people. They've seen all sorts of different things. There's a lot of misconceptions out there, so I want to clarify some of those. So let's get right on into it. Well, it's actually very simple, and very little of it happens here at Advocate Wellness, which people are very surprised at. They're like, I thought you treat neuropathy. We do. But here's the God's honest truth. If you can't feel the bottoms of your feet, do you want to be driving to my office? It's a safety concern, and I want to make sure we keep you safe. So for that reason, we provided the course of care to be at home as much as possible. And there's two major reasons for those, one of which we already touched on, and that's safety. If you can't feel your feet, or if they don't behave like they're supposed to, driving is just not as safe as it will soon be if we can accept your case and help you. But then the second part of it is that treatment frequency really matters. It's a game of momentum, of restoring, healing momentum. So at first, the ball is rolling the wrong way. So the first things we got to do is we got to stop it, and then we got to get it rolling the other way. Once we get it rolling, then it's easier to keep rolling than it is to get it started. But the truth is that treatment density matters tremendously. So at the beginning of care, what we recommend is a minimum of 7 times per week, of 7 treatments per week. Well, we're open Monday through Thursday. If you were going to get 7 treatments per week, that means you'd be in my office twice a day, every single week for quite a while. And that's a lot of appointments. Frankly, people have things to do in their life, and I'm not open 24/7. So that's an issue. So because of that, we have, for the convenience of our patients and for their best outcomes, we prescribe devices that they take home and supplements that get shipped to them and some creams and balms that they apply. This is what that looks like. Let me walk you through it real quick. So there are 2 devices. The first device is an infrared device. And this is what we call a light bath. You strap it to the back of your knee and the bottoms of your foot, and it shines light at a very specific frequency into your foot and is able to decrease the inflammation and to be able to soothe the pain in the nerves, as well as provide small amount of stimulation. Now, the second device is a foot bath, and this is very, very mild form of electrotherapy. There's a little device with a little 9 volts and a little dial on it. You put your feet in some nice, comfortable, warm water with a solution in there, and then you provide just a little bit of electricity to the water in a very safe manner, and that helps to provide stimulation and to help reorganize the nerves and the information they're sending back up to the brain. If you wanted to learn more about how the brain and the body talk to each other, go ahead and watch some of those first videos in this playlist about how the nerves are structured and how they function and how they relate to your body. We also talk about why it's an issue if these things start going out. Hey, if you're enjoying this video, please go ahead and hit the subscribe button. It helps us out a ton. It helps YouTube understand to show this to more people who might be dealing with issues like you or have questions like you might have. Make sure and click the bell as well to get notified when we drop some more awesome videos just like this one. So inflammation management is going to be primarily through the red light and through supplements. I will get into the supplements in just a moment. The stimulation is going to be primarily through lifestyle, through walking, which is going to happen more and more and more as you're getting to feel better and in less pain and able to do more and balance better and have more confidence. Then the oxygen delivery is going to be thanks to being able to get moving and getting that breathing and that deep breathing done. We help people walk through ways that they can increase their oxygen levels in their body, and also with decreased inflammation, that's going to improve the oxygen delivery to the cells and not just to the inflammation processes, because inflammation is very expensive and requires a lot of water and a lot of energy. It's very taxing on the body, so it's probably why you're tired all the time. So those 4 pillars, the ways we address them is like we described the 2 devices. Then supplements provide not just inflammation management, but they also help to reset hormones so that you can optimize those for ideal healing. If you are dealing with diabetes or you're dealing with another inflammatory disease, you know that your cortisol levels your insulin levels, your testosterone levels, just to name a few, are not going to be right. There might be brain fog, you might be stressed, you might be on edge, your blood sugar might be all over the place. These things are very common for the patients that we see and that we're able to help tremendously. So the nutrition that we provide is through supplements. We give very, very simple guidelines as far as nutrition, because people will sometimes ask me, do I have to get rid of everything in my pantry? Do I have to stop eating it? The answer is no, you don't have to. You would get better with just adding the supplements, but to the extent that you can make some of those healthier changes at home, and I only recommend making one, maybe two changes in your diet at a time, you'll get better and better and better. My goal is for the long term. Remember, our purpose is to connect people with the most effective, fastest health solutions. And so fast is nice, but effective means effective over time for the long term. So how do we help you build great habits that can help you be able to move forward with your health, such as introducing, we talked about things you can do at home to help with neuropathy and stuff like that. One of them is simply introducing a clean animal protein food early in your day. And it helps with feeling sated, with feeling like you have enough food, with feeling full for a while. And that also translates to feelings of happiness or like lack of stress, and then not needing to snack all the time, which helps your blood sugar stay lower, all of those things. So lifestyle and supplements help with oxygen delivery and with inflammation management. The devices help with stimulation and with blood flow. That's how we support the 4 pillars of nerve health. I hope this has been helpful for you guys. We'll see you in the next video.